friends attending us worldwide. My name is Eleni Moka. I come from Greece and I serve as ESRA president. And I have the privilege and honor today to interview Professor Agis Tsouros, who is a former director of health policy in WHO Europe, on this important topic that we will discuss during World Week and World Day of Regional Anesthesia and Pain Medicine. Professor Tsouros, welcome, and thank you very much for your kindness to participate in this interview.
My pleasure to be with you, and my pleasure to contribute also to your World Day and World Week.
So I will start directly with the questions, and the first question that comes to my mind, but I presume to everybody's mind, is why pain is still one of the world's most disabling yet neglected public health problems, despite its major impact on people's life and on the societies as a whole. And we are all eager to listen to your opinion as an expert in public health.
Well, thank you for this question. I have to say there is a huge paradox here. Pain is, I would say, a mega issue on a world scale that affects millions of people, and yet it's hugely unrecognized. And when we talk about pain, we talk about acute chronic pain, trauma, cancer, perioperative conditions, chronic diseases, musculoskeletal disorders, and it remains unrecognized. And the burden of pain on a global scale is immense because it is a leading cause of disability. It affects millions of people. It limits people in their mobility, their work, their social participation. It undermines their mental health, and it deepens poverty and inequality. I just want to give you a couple of figures from WHO recent reports. We are talking about 20% of adults worldwide who suffer from pain, chronic pain. 1.71 billion people live with musculoskeletal disorders and a huge burden related to pain. So painful conditions are responsible to a great extent for many, many years lived with disability. And also they are way above, I underline that, way above mental disorders and other major non-communicable diseases.
Thank you. The data are striking, I would say, and it seems that we as clinicians or all people involved in healthcare management probably have taken wrong pathways. So in this context, what is your opinion? What are the structural and policy failures? What structural and policy failures sustain still an unequal access to pain care, especially for the vulnerable populations and low and middle income countries? What is your opinion based on your experience over the years?
I really like the three keywords you have chosen for this year's World Day and Week: equity, access, and relief. I have to emphasize that relief is not charity. It is a human right to have relief from pain, and it should not be a privilege of the better off. So WHO is really gravely concerned that there is very low access to medication for moderate and severe pain. Imagine, Professor Moka, The poorest 50% of the world's population receive less than 1% of the morphine that is distributed worldwide. Pain is closely linked to the social determinants because they are linked to where people are born, live, work, and age. In other words, it has to do with our living and working conditions and the exposure we have to various risk factors to be affected by communicable diseases and non-communicable diseases. So what does this mean? It means that poorer people, people who live in low and medium income countries, but also people who live in poverty in prosperous countries, they suffer the most. Inequities reflect poverty, number one. They reflect geography. It depends where you live. They reflect weak healthcare systems. And they leave millions of people really at the mercy of chronic pain. So we also know that there is this paradox about opioid use, because in some countries you have opioid overuse, and in some other places there is no access to opioids. And in fact, because of the fear of overuse, restrictive regulations prevent people from having access to these essential medications or other essential analgesics. And lastly, I want to say behind all this, of course, besides access to medicines, we have lack of workforce, trained doctors, anesthetists, people who know how to use regional anesthesia in your case. This requires expertise. This requires equipment. This requires investments. So we end up in a very unequal world when it comes to pain. And we have, of course, always those who suffer the most. Who are they? Children, older people, rural communities, and in general, those who live in poverty.
Thank you. Thank you very much for this detailed answer. It is true that I would say that pain is a disease in its own right. And this is how we as clinicians, as perioperative physicians or pain doctors should treat the problem. And another question that comes immediately on the table is how can the healthcare systems under the universal health coverage build sustainable life course capacity for acute, perioperative, and chronic pain care, ensuring access to essential medicines that you have already mentioned, regional anesthesia or regional analgesia techniques, and above all, multimodal analgesia in all settings.
Well, let me start from the most important fact here. First, this issue, this huge global public health issue, has to be recognized for its seriousness. Number two, we all know that health is a right and it is also a political choice. What does this mean? The number one step is for politicians, for prime ministers, for presidents, for governments to make robust political decisions to ensure that nobody is left behind. That pain and pain, addressing pain holistically, should be part of what we call in WHO universal health coverage. There must be essentially, not here and there, Look, even in prosperous countries, you may find some hospitals have uh, pain services, some others do not. It depends where you live. It depends how many are interested in this issue. Here we're talking about guaranteeing to citizens essential medicines, expanding regional anesthesia and multimodal anesthesia, and related clinical protocols for people to be trained on, because we need data, we need to be able to identify where we have gaps, and to ensure that with appropriate skills, registries, digital tools, and regulations on opioid use, that these services will truly become an essential component of the coverage that all people should have, irrespective of where they live and irrespective of their financial circumstances.
Thank you. You spoke about something important, that even in the high income countries, there are still gaps in how pain is managed across their territories. And these gaps bring me to the next question. In your opinion, how does untreated pain or mistreated pain undermine societies, meaning how it can affect education, productivity, gender equity, and progress towards the sustainable development goals? What's your opinion about it?
Look, let me say something more personal first. I've worked with WHO for 3 decades. I'm familiar with the statistics. But you know something? Behind the statistics, we all have in our personal experience families, relatives, friends who we have seen suffering from pain, and whom we have seen being desperate and unable to find relief. And it is inconceivable that in 2026, 25, in this 21st century, that people should suffer when we know we have the means to address. The reason why I give that personal note is because the Sustainable Development Goals, in other words, the 2030 United Nations agenda, is really the basis of all the values and the principles that should drive our societies. And therefore, if you think that here we are dealing with a major disability, that pain impedes progress on multiple sustainable development goals. Untreated pain reduces workforce productivity, it drives economic losses, and it intensifies poverty by limiting employment and income. It limits education, participation, it worsens mental health, and it reinforces inequalities. So I go back to where I started also in the previous question, combined with this one. We are talking about an issue of human rights. We are talking about an issue that makes us a civilized society in the 21st century. It is inconceivable that governments, no matter where they are, they should not really offer comprehensive services to people who really are suffering and who could greatly benefit from what is available today.
Thank you. I think you gave a very, very strong message that we all have to act and react also. And in this context, in your opinion, taking into consideration the initiative of ESRA together with its sister societies. How do you believe ESRA can, with the sister societies, can lead through advocacy, partnership with WHO, and capacity building on the ground to deliver equitable pain care where needs are the greatest? What's your opinion or even your advice on this topic?
First of all, let me congratulate you on this great initiative. It is the third year that you are organizing the World Regional Anesthesia and Pain Medicine Day and Week. You have a fantastic partnership. I would call it a strategic partnership with all the other sister societies, including AFSRA and ASTRA and AOSTRA and LASTRA, ESTRA, of course, the Canadian societies, and then EFIC, WFSA, WIP, and so on. Very impressive platform you have created there. And it has to be very clear here. You have the potential to make a big difference because you can speak for your patients. You can be their voice. Don't only think in terms of, and I'm sure you don't, in terms of our professional and scientific interests. You are the ones who are closest to society, to people. And with these platforms, you can really bring about awareness about this huge issue. So, global leadership with strong scientific evidence, with the voice of the suffering of people from acute, chronic, perioperative pain. I'm delighted. I know that you are seeking now a partnership with the World Health Organization. And this is great news because what you do is absolutely aligned with the principles and the strategies of WHO. So you have the potential to become one of the strongest allies of WHO in this strive for a society which will be pain-free, your three words, equity, access, and relief. You have the potential, together with your partners, to also, in addition to advocacy, work on the ground, capacity building in countries, whether it is sub-Saharan Africa, Latin America, other places, to be able to transfer your knowledge, your expertise, your enthusiasm to others to be able to do the great job you are able to do in your countries, in your hospitals. And for this, I really wish you to have once again a more successful and impactful World Day and World Week. Thank you.
Thank you, Professor Tsouros, for the very kind words. I really like the way you put things in, I always like that, in a very nice, comprehensive order. I would like to just close this interview by asking you, in 2 or 3 words, what is your key message for our initiative?
Just believe that you have a great potential to make a difference in people's lives. Go ahead with that and be inspired by what you have already created.
Thank you very much. Thanks a lot for all your help, your time, and your support.
Thank you.